I'm Mike Davies. I'm the founder and chief executive of a biotech company called Bridge Biotec. We're based in the northwest of the UK at the moment, but we're a virtual company. We're developing new, safer treatments for serious inflammatory diseases, such as inflammatory bowel disease, atopic dermatitis, rheumatoid arthritis, all things like that. Safe because what we're developing are peptides. They're small proteins, peptides, that we deliver into cells using a nanoparticle delivery technology, and we've shown that they switch off inflammation, but not only do they switch off inflammation, they also prevent the activation of inflammation. So looking forward, of course, you'll take this new cream for atopic dermatitis to treat the active disease and then keep using it to stop it coming back.
Yeah.
So we're now looking for investment to prove that this new formulation works in human explanted tissue. We'll take some biopsies from people with inflammatory diseases such as ulcerative colitis, atopic dermatitis, rheumatoid arthritis, these sorts of diseases. Put our formulation on and measure that they actually switch off the inflammation in those conditions. From that, we'll be able to take the lead compound and the lead indication and drive that forward towards the clinic. That's about it.
And how much investment do you need at the moment?
At the moment, we're looking for a total investment of $1 million US. Now, that of course can be made up from all sorts of different combinations. But what that will do is demonstrate that these compounds work in human tissue and will allow it to drive on, so that first bit will take 8 months to a year, and then we'll need further investment to drive it through over the next 2 years to what's called the CTA, the regulatory approval for the clinical trials.
Are you currently listed on the market, or is that like early stage?
No, we're early stage.
No,
okay. We're early stage.
And your plan is to list on the stock market at some stage?
Lots of options that can happen once we've shown it works in human tissues, once we've taken it through preclinical development, and I think when we're into clinical development, that might be the best time to go for listing or sale or whatever. But as it progresses through this development, the cost goes up like that, but the returns go up like that. So the investment now, I think in a year I can make it 2 or 3 times. I think I would predict that in 3 years I can make it 10 times, and in 5 years I can make it 250 to 350 times.
Sounds impressive.
Well, those data I can show you. I can't show you data now, but look on. The classic drugs with a clinical proof of concept, which is where we are at, cells at about 250 to 350 million plus milestones and royalties. That's pretty standard at that stage, and that's where I want to take it to. So invest now, and you'll do really well in 5 years. Invest now, and if you invest in the EIS or the SEIS stage, then 3 years' time you'll be 10 times. And of course you can leave it in and let it go even further.
Do you have any debts at the moment in your business? It's all equity funded?
It's all equity funded.
Okay.
It is all equity, and that's how it will go forward until we sell, I think, or until we IPO, or whatever happens.
Okay, sounds good.
There you go.
Thanks very much, Mike.
That's my pleasure. Thank you very much, Sammy. Thank you.
Bye.